My name is Dr. Kristi Hughes. I'm a naturopathic physician. I'm a patient advocate, as well as I am an international speaker on lifestyle, nutrition, and functional medicine. Well, functional medicine is a movement and it's a philosophy. It's taken place, it's grown actually from inside of the conventional approach to healthcare to bring forward more of the science and the art in treating the cause of disease. So to make it really simple, what functional medicine does is it teaches physicians how to take a more robust history to try to identify and find what are the causes of a patient's disease pattern versus just managing the disease directly. So with functional medicine, there's equal leverage and importance placed upon that doctor and patient relationship. So it really brings in the importance of how the doctor communicates is just as important as what they're saying. And in this era today, where many doctors spend the whole session typing in their computers, taking their notes, charting, and avoiding eye contact and, handshakes and just the power of touch. We're really going into a very interesting phase or time in medicine where patients feel less connection, less integration into their healthcare process and sort of feeling like they're moving through a system. So functional medicine helps to support physicians through the knowledge, through the science, and through artistic skill gathering so they can get back to why they usually went into medicine for the first place, which is really, truly to help people heal. It's interesting when we look at the causes of those causes of disease, it gives us a chance to figure out how we apply food, lifestyle, and very specific interventions to help get to where did it start and where has it come from. For me, I've been training health coaches for more than a decade, and I've had health coaches work with me and have worked with hundreds of doctors that I know. And so what I have really seen to be the greatest benefit that they bring to a medical practice is the ability to take the time to help a patient uncover their true health goals. This is really the space that is really held beautifully for the health coach because very few practitioners have the time or even the knowledge set to know how to help a patient figure out where they want to go next. So one of the realms I love about health coaching in medicine today is their connection with the patient, to be able to nurture the patient, help that patient uncover their true health goals, help them identify obstacles, and create a very specific strategy to move through those stages of healing. And I think health coaches have such a great foundation in nutrition and lifestyle that then healthcare providers can work with those coaches to do further advanced education on their behalf with the patient. They're just a wonderful extender for the healthcare provider for care in the office. Well, I think they need to get very clear with the large scope that's out there in healthcare today and really narrow in on the right niche. So you've got physicians and practitioners who have an affinity towards functional medicine, which we've talked about. It's a really specific niche, so therefore a health coach is going to need to coach in that paradigm, right? You have integrative medicine, which is a wonderful way of grabbing important, valuable assets from conventional medicine and alternative CAM medicine and really bringing those together to work for the patient. So integrative medicine often involves a whole broad range of therapeutic interventions to choose from. Maybe looking at meditation and acupuncture, along with diet and nutrition coaching and possibly medication use. So integrative really truly speaks to the eclectic ability to draw from resources to better support the patient. Functional medicine is a philosophy. It's an approach to patient care and a patient history. And then you also have this new scope that's opened in the last decade called lifestyle medicine. And so lifestyle medicine is not necessarily looking at the whole range of integrative approaches, and it isn't anchored in a functional medicine paradigm, but a lifestyle medicine practice is acknowledging that our foundations with sleep and stress and diet and movement and our relationships are fundamental to the healing process and the creation of disease. So I would encourage health coaches to know who they're going to talk to. Are they an integrative doctor with a functional medicine approach that uses lifestyle medicine? Are they a conventional doctor who's just started to dabble with lifestyle medicine? Have they been an integrative provider and they've been doing this level of work for 30 years? They're going to be looking for an advanced coach to help with patient education. So I'd say know your audience in exactly the same way you need to get to know your patient. They really need to look at the specs of how that practitioner is integrating his different tools so they know how to language what strengths they bring to the table and how they can yet be a solution for their healthcare team. Well, I think the most exciting aspects of doing functional and integrative care is helping patients develop a level of an awareness of how they got here. Because typically they'll have the diagnosis, they'll have a label, they won't have a lot of ideas about their underlying physiology. And I actually really step back and take the time to show them pathways, show them how these different nutrients interact with their tissue, or what's going on in type 2 diabetes, or what is the true mechanism in osteoporosis, for example. And what I find is that patients love that knowledge. They want to know what's wrong, what's going on, and that gives us the ability to step in and use visualization, to be able to work with the power of the mind, to really integrate their healing process. So I think the most valuable things I see that impact patients are them learning the details about themselves. And once they know how they've gotten into that position and they're given specific choices they can make to change things, they are in the driving seat. They make the right choices to modify lifestyle and behavior. They see those net results. And I think the most powerful thing that we can give patients, again, is that they are the boss. We as healthcare providers, we work for them, and we need to get that paradigm shift in place for patients so they don't feel bad firing a doctor and finding a new one if they're really not hearing them and serving their needs. So I think patient empowerment really brings with it transformative healing, because so often it's not the experience that they're having. I think that there is a place for every physician in having a health coach on their team. And I think the role for a health coach is not only in the office, but it's also going out into the community and being able to really bridge some of the gaps that exist in the grocery stores, in the health food stores, in the schools, in the communities around. So I think a real key role for health coaches is being an extender for that office into their community to make sure that all those points of connection are there. And people in the communities need to know what's going on in those offices, and health coaches are a remarkable bridge to get there.
The single most thing you could do to help someone is really be there to listen and to back them up. They have a right to be their own health coach. They have a right to get answers.